Right around the 2-week point is when most people get their drains out, all 4 of them or however many you had. If not, then you would want to stay probably a little bit more in the protected phase until that. And this next phase goes typically from 2 to 4 weeks. And this is a phase we can start adding some more range of motion. We want to avoid stretch and we want to avoid pain. So we're still trying to protect our healing tissues. So the same exercise I was doing lying on my back, I can do here in sitting to get a little bit more muscle activation since I'm against gravity. But I personally found starting with a short lever arm was more comfortable for myself. So I started with my fingertips on my shoulder, and I can just go up and down here, just in whatever range of motion feels comfortable for me. Okay, and then the same thing coming out here to the side. Good. And then we can lie on our back with the wedge pillow or without, whichever is more comfortable for you. And we want to try to start targeting our serratus anterior, which is our deep muscle in the front of the shoulder. It runs deep to our pec muscle here in the front. It is a huge shoulder stabilizer and going to be a really important muscle we target. So we can straighten our arms up to 90 degrees. Just gently open the palm, not all the way, but we just don't want it closed. And we're just gonna punch up to the ceiling and then come back down. So the elbow stays straight through the whole motion. I'm just punching up and then punching down, being conscious not to let my shoulders shrug up to my ear, slight squeeze down as I punch up and then coming back down. Good. And then I can go ahead and clasp my hands palm to palm and go through more range of motion here to where it feels comfortable. Being conscious I'm not overarching my back. I want to try to keep it a little bit more flat to the table and then coming back. Good. For people who had just a lumpectomy or a single mastectomy, you can take your non-surgical side and clasp your surgical side, and that will make it more passive so the muscles aren't having to work as hard. So my right hand is helping my left hand to go through that range of motion. But for a bilateral mastectomy, both sides are involved, so I found hand-to-hand or palm-to-palm worked really well for me, and I can go through that range of motion here.